Dr. Sanjay Kumar Choudhary. I'm a senior consultant at Institute of Brain and Spine, IBS Hospital in New Delhi. Today, I'm going to speak about Lasmiditan, which is a novel drug for the treatment of acute migraine. So, first, I would like to let you know that migraine is a headache condition which occurs in episodes, and episodes usually last for 4 to 72 hours, often accompanied by such symptoms as nausea, vomiting, hypersensitivity to light and sound. We call it photophobia and phonophobia. In some of these cases, migraine may be preceded by a brief aura, which may be auditory, which may be visual, which includes sensory changes or other neurological symptoms which are reversible. The exact cause of migraine is currently unknown, but it is thought that it is because of the release of pain-producing inflammatory substances around the nerves and the blood vessels of the head involving the trigeminal system. Migraine is characterized by recurrent attacks and is often lifelong, usually precipitated by certain triggers. The global prevalence is well over a billion people, and the disability and burden makes it significant among all the neurological disorders because it affects the quality of life, especially in the young people and those who are working people, causing them loss of work days. But the problem is there is a lot of limitations of the current acute migraine treatments. Whenever the migraine strikes, there is a gross disability, and for which there are options available. Like we go for commonly NSAIDs, which is painkillers like acetaminophen, non-steroidal anti-inflammatory drugs, and opioid drugs, and a novel class of drugs called triptans. But even with these so many drugs being around for so many years, decades on end, these therapeutic drugs are effective in many individuals, but they are not appropriate for all patients, and they have contraindications in certain patients, and they cause potential side effects. In addition, there is overuse of acute medications. They can lead to chronicity of the migraine, and they can cause further side effects. So there is an unmet need in the migraine therapy in acute conditions. We need a faster onset of action of the drugs. We need improved efficacy of the pain-free status at the end of 2 hours and better tolerability and safety profile. We need an effective treatment for patients with contraindications to the current therapies. The solutions for refractory or chronic migraine patients are also needed. Now, in this situation, Lasmiditan is a novel approach in acute migraine treatment. The Lasmiditan has a novel mechanism of action. It is a new class of drugs called DTAN, which targets the 5-hydroxy tryptophan 1F, serotonin 1F receptor. The proposed mechanism includes decreased plasma protein extravasation and reduced CFOS expression and inhibition of CGRP release. The Lasmiditan is a novel approach to acute migraine treatment. The pharmacokinetics are that it is almost about 40% bioavailable. It can be taken with or without food. The peak plasma concentration is reached within 1.5 hours with the onset of action in 30 to 60 minutes. So within 2 hours, we have the maximum efficacy of the drug, what is needed. It is not metabolized by CYP enzymes, reducing the risk of drug interactions. Majority is excreted in urine as a metabolite SM8. Now, this is the depiction of the Lasmiditan's mechanism of action. Whenever the migraine triggers like hormones, alcohol, caffeine, stress, lack of sleep, irregular sleep patterns, or change in weather strikes, it acts either on the trigeminal nucleus complex, or it acts on the trigeminal vascular system, or it acts on the trigeminal ganglion, triggering off the serotonin and blood vessels to go into dilatation, for which we need lasmiditan, which acts via both a central neuronal activity as well as a peripheral neuronal activity and blocks the release of CGRP, resulting in the absence of migraine symptoms or reducing them. So this is the mechanism of action in brief. The clinical significance is that lasmiditan has shown efficacy in rapidly alleviating the migraine symptoms, including not only the headache pain, but also the associated symptoms like nausea, photophobia, phonophobia, and the duration of action is less than an hour, and you providing timely relief for acute migraine attacks. And it has been approved in FDA just 5 years back in 2019 for acute treatment of migraine with or without aura. The dosage of lasmiditan has been tested in phase 2 trials by Colmig 202 and 201 study. The dosage in 202 study was 50, 100, 200, and 400. And the primary endpoint was headache response at the end of 2 hours. The results were there was significant efficacy at 100, 200, and 400 mg dosage. Whereas in 201 study, a lower dose of 2.5, 5, 10, 20, and 45 milligram was used. Again, the endpoint was headache response at 2 hours, and the results was dose-dependent efficacy. It was significant at 20 milligram. But the beauty of the molecule was that there was no serious adverse effects in the phase 2 trials. Most of the adverse effects were mild or moderate in intensity. No clinically significant effects on blood pressure or heart rate were observed. And unlike the triptans, no vasoconstrictive effects were noted. So it can be safely given in those who have coronary artery disease or who have cardiac conditions. The safety and tolerability assessment across the phase 2 study revealed that in spite of the minimal CNS side effects, most of the patients, they tolerated the treatment well, and the dropout rates due to adverse effects were very low. Most adverse events were transient and usually resolved within 24 hours. The clinical evidence which supports the lasmiditan for migraine treatment in phase 3 trials, there were mainly 3 trials, the Samurai, the Spartan, and the Gladiator. I will briefly discuss each of these trials, and these were done to evaluate the efficacy, the safety, and the tolerability of the lasmiditan, a selective serotonin 5-HT1F receptor against acute treatment of migraine. The Samurai study, it was a randomized, blind, placebo-controlled phase 3 study. It included 1,856 patients with migraine. They were randomized to 1:1:1 oral lasmiditan 200, 100, or placebo. The Samurai study, the result was pain relief was found significantly at the end of 2 hours with lasmiditan as compared to placebo. It was more so with 200 milligram, 38%, versus 100 milligram, 31%, and 50 milligram, 28.2%. The Samurai study results, the most bothersome system relief were noted at within 2 hours, 40% for 50 milligram, 44% for 100, and 48% for 200 milligram. And it was very safe. The common side effects included only dizziness, fatigue, and paresthesia, which were usually mild to moderate. And the Spartan trial was a randomized double-blind placebo-controlled trial, which included about 2,000 adults with a history of migraine. Here also 50 milligram, 100 milligram, 200 milligram versus placebo were used. The pain relief was similar to the Samurai, with more relief with 200 milligram as compared to 100 and 50 milligram. And the most bothersome symptoms were also most commonly relieved with 200 milligram dose, 48%, 44% for 100 milligram, and 40% for 50 milligram. The safety side effects were consistent with those observed in Samurai trial, with dizziness, fatigue, and paresthesias being most common. The Gladiator trial, the long-term safety and efficacy of Lasmiditan was assessed. It was almost primary objective was evaluate the safety, and secondary objective was efficacy. 100 milligram or 200 milligram for acute treatment of migraine for attacks up to 1 year was noted. Enrolled patients who had completed previous single attack Lasmiditan, Samurai, or Spartan were included, and the patients were randomized 1:1 to either 100 or 200 milligram dose, and safety were assessed throughout the study. And the migraine disability assessment Midas score was assessed at each visit. Out of the 1,978 patients who were received one Lasmiditan dose, total of 19,058 migraine attacks were analyzed. No treatment-related serious adverse effect was noted. The most common treatment emergent adverse effects were dizziness or somnolence or paresthesia, ranging from 6.8 to 18.6%. There were no cardiovascular abnormal side effects, and only 12.5% discontinued this medicine because of adverse effects. So, at the efficacy was assessed by 2 hours post-dose across all the treated attacks. Pain freedom was there in almost 27% with 100 milligram and 32% with 200 milligram. But most bothersome symptom relief freedom was 37% with 100 milligram and 40% with 200 milligram. The pain relief was 54% with 100 milligram and 57% with 200 milligram dose. The efficacy measures generally consistent over the study quarters, and the Midas score decreased over time. So the conclusion of the Gladiator trial was that the interim results showed intermittent 100 and 200 milligrams generally well tolerated and efficacious for acute treatment of migraine over a 1 year period. Safety and efficacy were consistent with the previous single attack studies. After that, then post-marketing surveillance was done, and it has continued to support the efficacy and safety profile of Lasmiditan. The real-world evidence from patients and the healthcare providers' feedback were noted, and the findings included the efficacy was there within 2 hours of administration of the tablets, and the safety incidence and the type of side effect was consistent with the clinical trial data, further validates the Lasmiditan safety profile. The superiority of Lasmiditan over other available drugs for migraine treatment was analyzed. Because of the unique mechanism of action, selective HT1F receptor agonist, unlike triptans, which targets the 5-HT1 receptors, may lead to vasoconstriction. Lasmiditan specifically activates the HT1F receptors, so the vasospasm component is missing. This mechanism does not cause vasoconstriction, which is particularly beneficial for patients with cardiovascular risk factors, making Lasmiditan safe for a wide range of patients. Now, the safety profile was also because of the cardiovascular safety and mild side effects. The common side effects of Lasmiditan, such as dizziness, fatigue, and paresthesias, were mild to moderate and typically transient. The superiority of the Lasmiditan over other available drugs for migraine treatment because of the rapid pain relief within 2 hours, because of the quick onset of action, which is as effective as other acute migraine treatments. Relief of the most bothersome symptoms was also there, and there was absence of nausea, photophobia, phonophobia. All these symptoms led to more compliance of the patient and enhancing the overall quality of life during the migraine attacks. So the superiority of Lasmiditan over that of other drugs for migraine treatment, there was no migraine overuse headache with the use of lasmiditan. So it was used in those patients who had medication overuse headache, causing more relief to the patient. And there was improved patient outcome. There was enhanced quality of life of the patients without causing any significant side effect or cardiovascular concerns. The superiority of lasmiditan over other drugs for migraine treatment included the flexibility in the patient population, because it was available for use in a broader patient range, those who cannot take triptans because of cardiovascular risk, or those who do not respond well to the traditional treatments. In those cases also, lasmiditan was used. Lasmiditan is efficacious and safe for patients who do not respond adequately to triptans. It is understood that almost 43% of overall population safety is a concern, and triptans they have insufficient responding. So majority patients are classified based on the triptan efficacy alone. The inclusion criteria was patients with moderate migraine-related disability. TIR group had a higher MEDA score compared to triptan-naive or sufficient responders. So more TIR patients are from Europe, fewer from Asia, because Asians, we use triptans less. This is the reason why this is a great help in patients who have not been able to managed with triptan. The key finding from Centurion study was that lasmiditan is effective and safe for patients who do not respond adequately to triptans. Am I audible and visible?
Yes, sir. You cannot.
Yes, sir. Yes, sir.
So now my slides are stuck up. Let me see. Let me go back. Yes, I have been gone through this. So key findings from the Centurion study was that lasmiditan is effective and safe for patients who do not respond adequately to triptans. Lasmiditan is effective in acute migraine treatment, similar to other study. Efficacy not influenced by excluding patient based on tolerability and contraindications. So lasmiditan has been used over 4 migraine attacks in randomized trials, and almost 1,471 patients were randomized to 3 different groups, 200, 100, and control group. And the control group received placebo for 3 attacks and lasmiditan 50 milligram thereafter. The randomized control trials of lasmiditan over 4 migraine attacks, the primary endpoint was pain freedom at 2 hours post-dose, which is the first attack, and pain freedom at 2 hours, at least 2 of the 3 attacks. And the efficacy results were first counted. First attack, pain freedom at 2 hours was 29% with 200 milligram, and lasmiditan 100 milligram, it was 25%. Placebo, it was only 8.4%. The pain relief at 2 hours was lasmiditan 200 milligram 65%, and lasmiditan 100 milligram 65%. So 100 milligram and 200 milligram were equally efficacious. And the key efficacy result with the consistency of response was noted. Pain freedom in more than 2 out of 3 attack was there with lasmiditan 200 milligram at 24% and lasmiditan 100 milligram at 14%. And pain relief in more than 2 out of 3 attack was in 200 in 66% and lasmiditan 100 milligram in 62%. So more patient had pain relief. Pain freedom was relatively less. And the randomized controlled trial for lasmiditan over 4 migraine attacks, the secondary endpoint revealed that there was early onset of effect. The pain freedom at 1 hour was significant for both the doses, 100 and 200, and sustained pain freedom was at 24 and 48 hours for both the doses. The significant improvement in migraine-related functional disability was there, and the efficacy demonstrated in patients with insufficient response to triptans. So apart from being much more effective than the triptans, the efficacy was maintained for longer duration of hours, for 24 to 48 hours. Significantly more patients thereafter were feeling much better and very much better on patients' global impression of change with lasmiditan as compared to placebo at 2 to 24 hours. So if we do a comparative analysis between lasmiditan and triptans, apart from the mechanism in which the lasmiditan affects the 5-HT1F receptors, which are non-vasoconstrictive, the triptans target the HB1B and 1D receptors, which are vasoconstrictive. The safety is a lower cardiovascular risk factor with lasmiditan. Triptans have a high risk cardiovascular side effects. Efficacy-wise, the comparable pain relief, lasmiditan offers additional most bothersome relief with favorable side effect profile. When we compare lasmiditan with NSAIDs, the mechanism, lasmiditan, as we know, is a targeted migraine therapy. NSAID is non-specific, is a general pain relief. The safety-wise, the lasmiditan avoids the GI and renal side effects, which are very common with NSAIDs. We have seen patients having GI bleed and gastritis because of the repeated use of NSAIDs. Efficacy of lasmiditan offers specific relief from migraine symptoms, whereas NSAIDs is effective mainly for the pain relief. We have to add other drugs to take care of the nausea, vomiting, and other aura symptoms. If we compare lasmiditan versus ergots, the mechanism of lasmiditan selective HT1F and agonism versus ergot's non-selective serotonin receptor agonism, lasmiditan has a better safety profile with fewer side effects. Efficacy-wise, lasmiditan provides targeted relief with fewer risks of prolonged vasoconstriction, which are seen with ergots. We have seen patients having vasospasm and gangrene because of ergot use. So if we do a comparative analysis, the conclusion is that lasmiditan has significant advantages over other available drugs for migraine treatment. Its unique mechanism of action and superior safety profile and rapid efficacy and suitability for a broader range of patients makes it a valuable addition to the arsenal of the acute migraine therapies. For patients, especially those who have a cardiovascular risk factors or those who are not responding to the other treatments, lasmiditan provides an effective and safer option for managing acute migraine attacks. So I will, in my next few slides, mention the few of the case study scenarios which we see very often and how lasmiditan works as a beautiful option for managing those selective group of patients. In this case, first case, a 45-year-old female with a cardiovascular risk. Patient had a medical history of hypertension, high cholesterol, family history of cardiovascular disease. There was a migraine history also for almost 20 years, typically 3 to 4 attacks per month. The previous treatments included triptans, which were ineffective and contraindicated because of the cardiovascular risks, NSAIDs, which provided partial relief, and preventive medications, which had limited success. So in this scenario, a patient who has severe migraine attacks characterized by throbbing headache, nausea, and photophobia, giving her cardiovascular risk factors, her neurologist prescribed lasmiditan as acute treatment option. And the outcome was that the patient taking lasmiditan at the onset of the migraine attack, she reports significant pain relief within 2 hours and a marked reduction in nausea and photophobia. Safety-wise, there is only mild dizziness no serious side effects, and importantly, there are no cardiovascular concerns. The patient satisfaction was very good with rapid relief and absence of serious side effects, thereby improving her quality of life. In this next case, a 30-year-old male with frequent migraine, with a medical history of healthy, no cardiovascular risk factors, but the migraine history was that it was very severe, episodic migraines, about 6 to 8 attacks per month, often triggered by stress and lack of sleep. The previous treatments over the counter pain relief and like analgesics and NSAIDs were ineffective. Triptans had moderate relief, but they had unpleasant side effects, not tolerated well. In this clinical scenario, patient needs a more effective treatment for his frequent migraine, and his neurologist prescribed lasmiditan. So outcome was that the patient was efficacious and the lasmiditan relieved the migraine attacks, and there was substantial pain relief within an hour. He also experienced less nausea, light sensitivity. His safety was maintained with only minimal fatigue and dizziness, but these symptoms became easily manageable. The patient satisfaction as a result was good. He appreciated the rapid onset of action and the ability to continue with his daily activities with minimal disruption, including his work. In this third case, there was a 50-year-old lady with migraine and depression, and the depression was usually managed with SSRI and chronic migraine. Because of the migraine for 25 years, she had only 2 to 3 attacks per month associated with hormonal changes, and the triptans were effective, but there was a concern over interaction with SSRI. The preventive medications, they had limited success. So in this current scenario, because of the severe migraines that disrupts her daily life and mental health, triptan interaction with SSRI was also there in the back of the mind. A neurologist thereby prescribed lasmiditan. An outcome was very favorable. She takes lasmiditan at the onset of a migraine and reports significant relief within 2 hours with reduced headache intensity and reduced symptoms. Mild dizziness is the only primary side effect with no serious interactions with her SSRIs. The patient finds lasmiditan to be a safer alternative to triptans, alleviating her concerns about drug interactions and improving her overall well-being. In this last case of, it was a 28-year-old lady with menstrual migraine, and she has regular menstrual cycles, but the migraine typically occurs around the menstruation, and it lasts for 3 to 5 days with intense headache, nausea, and previous treatments, including hormonal treatments, were having limited success. Triptans were effective, but they caused significant fatigue as a side effect. So in this clinical scenario, patient was a good candidate for a more tolerant treatment for her menstrual migraines, and her neurologist prescribed her lasmiditan. And the outcome was very satisfactory. Efficacy-wise, she experienced substantial pain relief within 2 hours and reduced nausea. And the safety-wise, there was mild dizziness and fatigue, but they were less severe than those which were observed with triptans. So patient satisfaction was there. Patient appreciated the pain relief with fewer side effects, allowing her to manage her menstrual migraines more effectively. So to summarize, we will say that lasmiditan is rapidly acting, causing significant relief of the migraine attacks, including the headache pain, nausea, photophobia, and phonophobia within half an hour to 1 hour of administration of the oral tablet. And the safety wise, the clinical trials phase 2 and phase 3 And the post-marketing surveillance has indicated a favorable safety profile, with the most adverse effects being mild to moderate and transient in nature. There was no significant cardiovascular risk effects. The patient outcomes were very effective for those who were not responding to other NSAIDs or who could not take triptans, thereby expanding the therapeutic options. The quality of life has also improved because there is less headache, there is early relief, and because of the sustained pain relief for 24 to 48 hours. And because of the good effective symptom management and minimal side effect, there was a dramatic response. The future implications for lasmiditan: it is a promising alternative for acute migraine therapy, particularly for patients with cardiovascular concerns or contraindications to other therapies. I would like to thank you for a patient hearing. If there are any queries, I would love to answer them. Thank you.
Yeah, thank you, sir. I think there have been a few inquiries. I think, Giridhar, I mean, can you help us with the queries which have been put in?
Yeah,
Yes,
sir.
I dropped one
In the
query
chat
in the
box.
chat box.
The
Okay.
first question is from Dr. Ashish. What is
Narwaria.
the... Yes.
Yes.
So, sir, Dr. Ashish is asking what is the mechanism of action of drug lasmiditan?
Yes. Lasmiditan is basically, it is a ditan group of drug, which is acting at HT1F, and it is an agonism, and it blocks the CGRP and thereby causing the migraine symptom relief. Both the headache as well as the associated nausea, vomiting, photophobia, and phonophobia are equally taken care of without the side effect profile of 1A and 1D because of vasoconstriction, which is there with triptans. So it can be used in all group of patients, be it young, be it pregnant women, or those who have menstrual cycle abnormalities, or those who are geriatric patients also. So it is good.
Right, sir. Thank you. I think, sir, there's another query which has been there.
Yes.
Once again, sir, it is being asked, is it safe for geriatric patients also?
Yes. In geriatric patients, mainly because of two things. One is that they more often than not, they can have underlying cardiac disorders. So it is safe in those patients, and especially because they might be on other drugs, which drug-drug interaction is minimal with lasmiditan. So it is a safe drug. It can be used even in geriatric age group patients.
Right, sir. Right. Once again, sir, the another query, as we can see, is is about drug-to-drug interactions with lasmiditan, sir.
Yes. Normally, the drug-drug interaction is minimal, and it is less because it is metabolized through a different route, and it is mainly excreted in the urine. So it is a safe drug, and without any much of a significant drug-drug interactions.
Right, sir. So that addresses it. Once again, sir, the another query which has just come in is, can we replace triptans to lasmiditan due to the cardiovascular risk?
Yes. So if the person with a migraine has a cardiovascular risk factor, then triptan is not a good drug because it may trigger off vasospasm, and it may cause MI, and
Correct.
it may destabilize the cardiac condition. So it has to be avoided at all cost in those patients who have cardiac involvement. So in those cases, this is a very safe medicine. So lasmiditan can be definitely used in all those patients who have cardiac issues. It is a safe drug.
Correct, sir. Correct. Meanwhile, sir, another query which has just been floated in is about the contraindications, if any, sir, for lasmiditan.
Yes. So lasmiditan, only thing is that if the patient has those very rare, but anaphylactic reactions are very rare, and those who have severe dizziness, and those who are not able to tolerate, like drowsiness, like somnolence, so those patients who are not able to tolerate. So in those cases, it's better be avoided. So in fact, in the trials, almost 12% patients were not able to tolerate lasmiditan. So in those cases, they had to be withdrawn. But these are not exactly absolute contraindications. These are all relative contraindications. Those who can withstand, they should be taking it.
All right, sir. That really helps. And another thing is, sir, any general side effect it is being asked is if there are any general side effects with lasmiditan shown, sir, more or less in all type of patients.
Yes. So whoever has migraine, they are having headache, they have having nausea, vomiting. Some people have dizziness also. But it has been observed in those patients, if you give lasmiditan in a selected group of patients, they had drowsiness, they had dizziness, and they had some sort of a inability to tolerate lasmiditan. So after the drugs, they were feeling worse off. Only in those selected cases, we should avoid them. But as such, minimal dizziness, and most of the dizziness passed off. The drowsiness also passed off. Because they are all acting at the central nervous system. They are acting at the trigeminal pathways. So
Correct.
it does have an effect, but it is very minimal, and compared to the main devastation which is caused by migraine attacks, this is nominal price for paying it. So those who can withstand it, they should be using it.
Right, sir. Right, sir. Thank you. That also helps, sir. Now, a very important, sir, query which has come in is, the question which has come in is, can lasmiditan be considered as a first-line drug for managing the acute migraine?
Yes. So in acute migraine, most of the time when patient comes to us, patient has already been to the general practitioner or physicians, and usually they have tried paracetamol, acetaminophen, diclofenac, and whatnot. So they have been through it. Only when it is not getting relief, or they are experiencing a side effect because of that, when the triptans are also being used. So in those cases, when triptans patients are not tolerating, still having headache, then this is, but obviously, it cannot be used as a first line. First is always, if the pain is mild, I also use only paracetamol. If the pain is very nominal, I say you take Brufen or naproxen, and your headache will be taken care of. But those who have a severe headache, who have nausea, who have vomiting, who are not able to do their job, in those cases, then we have to hit hard and hit at the earliest. Because when the headache has started, all the medicine which is to be effective has to be taken within half an hour to 1 hour. Else, if the migraine starts, then after 2 hours, analgesics will not have much of a role. Then they will have to be given injectables or aggressive therapy. So ideally, all therapies, if it is a mild, we have to give with NSAIDs. But then if they are not tolerating it, as has been with the past history, then we should go for lasmiditan.
All right, sir. So the another question which has dropped in is it safe for, in pregnancy or in the adolescent stage?
For adolescents, yes, it can be used. Actually, the trials which has been done so far, we have not tested in the pregnant woman. So we don't have the profile. So we cannot absolutely recommend them in pregnant women. But there are other drugs which should be given, like NSAIDs. But as we have a more robust experience in future, we might be able to use them. Technically, it
Right.
is safest among all the drugs.
Right, sir. Right, sir. Sir, another question which has come is how to decide, sir, whether to, prescribe 50 mg or 100 mg to a patient.
Yes. So normally we say ideal, the best therapy what we have seen is 100 milligram dose. But point is, we are not sure initially when the patient whether he will tolerate 50 milligram well or not. So ideally, we should go for a 50 milligram when patient is being used for the first time. And based on the how he has responded, we can select for the next migraine attack 100 milligram.
Right, sir. Right. Yes, sir. Now the other, sir, query which has come is, a patient with migraine, and having aura, and patient is working. So how to, sir, take care of the sedation part?
Yes. So when the patient is having aura, so there are best suitable for this drug because Lasmiditan, apart from being acutely effective, will also take care of the aura part, and it will have minimum side effect because with aura sometimes they can have other side effects. They can have a stroke, they can have so these are very rare possibility. So with triptan, so better thing is we go for this Lasmiditan, which will have a good effect, and sedation will be there. So that's why as soon as the aura or the headache starts, if you give the dose, and as such with aura on, person has better take some rest. Sedation will be very minimal, I would say, with Lasmiditan as compared to other drugs.
Right, sir. And also, sir, one of the things which is being asked is, can Lasmiditan be given for chronic migraine?
Lasmiditan is a acute
Migraine.
migraine therapy. So in chronic migraine, if there is the acute on chronic, then we can use it occasionally. But yes, if we use it very frequently, it will not be that effective. Rather, we should go for prophylactic drugs.
Drugs.
There are other options available, including neuromodulation, which is coming up in a big way. So those should be used. Lasmiditan, any drug, if it is used very frequently, then the efficacy goes down and it is not efficacious. Though in other medication overuse headache, we have seen Lasmiditan having a good response. So in those patients who have been on other drugs and still that they have acute attacks, for each of those attacks, then Lasmiditan can be used safely.
Right, sir. Right, sir. And also, sir, there have been queries about, how, could if there is any way to manage the sedation, which is being caused by Lasmiditan, sir.
So if the sedation is there, we have to try with a lower dose. As we have seen with 50 milligram, it is around 28%, and with 100 milligram, it is 34%. So lower the dose will be less sedation. So it is only efficacy will be less, but I think lower dose will be the only way we can go about it.
Right, sir. Right, sir. Another thing, sir, which is coming up is Lasmiditan in hemiplegic migraine, sir.
Yes, it is very safe in hemiplegic migraine because there is no vasospastic component because it targets 1F, so HT1F, so it is safe. So no vasospasm, so it can be used in hemiplegic migraine.
Hemiplegic migraine also, sir.
Yes.
Right.
Yes.
And how do you find, sir, the scope of Lasmiditan in the migraine therapy, sir, which is being asked?
So Lasmiditan is a novel class of drug, detans, which is mainly for acute attacks in migraine, especially if it is moderate to severe, then it is very efficacious and it can be used. Only thing is that because the patients feel dizziness, so patients should not be driving. But in office, patient can use. At home, patient can use it safely. So it is here to stay. Migraine, because of its side effect profile, is the best out of all the currently available. There is no fear of any nephrotoxicity. There is no fear of any gastrotoxicity. There is no fear of any cardiac toxicity. So with this, our side effect profile is taken care of. Efficacy is well maintained, and it is quite efficacious over 24 to 48 hours. So Lasmiditan is here to stay in acute treatment of migraine therapy.
Wonderful, sir.
But
Right,
the
sir.
but the lookout is on, because no drug is 100% successful. So there are other lookout is still on, because we have not found the wonder drug which is efficacious for all patients without any side effects. So we are looking for better drugs, but this is a wonderful class of drugs which has the minimum side effect and best efficacy.
Right, sir. Right, sir. I think, sir, those were the major queries which have, come in, and might be, sir, post session also there would be some queries which would be floated in. So, where we can take your, response and, share it across with the other doctors. So, I think, sir, so with this, and sir, it's very much on time. So with this, sir, I think, I'll take this opportunity on behalf of Hetero, to thank you with all my gratitude and to extend my hearty vote of thanks for taking your time out of your, schedule for this educative webinar. And sir, I feel very privileged to have this opportunity to hear from you about your thoughts on Lasmiditan as a novel drug, in the management of acute migraine, and not only about Lasmiditan, but also about the other treatment options which are available, sir, like triptans. So had been very, very informative, sir. And it gives us a better insight and understanding, on Lasmiditan for the management of acute migraine episodes, right, which is growing in subcontinent across. So thank you, sir, once again for giving your valuable time, insights, and clinical experience on the drug. And I would like to look forward, sir, and to have more such opportunities to have your valuable insights, not only about the migraine, but also about other your key areas of interest like epilepsy, stroke, and the other things. So thank you so much, sir, for taking your time out. So once again, on behalf of Hetero, sir, we are full of gratitude, and thank you so much.
Thank you. It was a wonderful session. I loved all the queries and your active participation. It was quite an interactive session at that. So I'd like to thank you, Hetero, and your entire group of persons who are helping in this IT team, including and Ravinder and Nirajji. Thank you very much.
Thank you so much,
And
sir.
Look forward to further
Thank you, sir.
success.
Thank you so much, sir.
Thank you.
Absolutely, sir. Thank you so much, sir.
Thank
Wishing
you.
you a very good night, sir. Thank you. Please take care,
Good
sir.
night.
Thank you.
Good night.
Thanks, sir.
Good
Good
night.
night.
Thank you.
Good night. Good night.